Welcome to Strata Medical Innovations Hand-Held Nitrous training video for the nose cannula and mask accessories. Hand-Held Nitrous is the easiest and guaranteed to be the least expensive way you have to deliver 5 minutes of pain and anxiety reduction in your patients. There are no heavy gas tanks or expensive evacuation plumbing required. Hand-Held Nitrous delivers an average of 39.6% nitrous oxide with ambient air over a period of approximately 120 seconds. This amount of nitrous oxide has been found to be safe and effective without causing dangerous levels of hypoxia or having extended negative effects of the gas. The device is supplied non-sterile and can be used on any patient that is over 3 years of age, that is not pregnant, and is 1. About to receive a procedure with local anesthetics or numbing gels, 2. Is about to have an uncomfortable exam or injection, or 3. Shows any form of short-term discomfort or nervousness. Adults can have up to 2 doses per procedure per day. Children can have 1. Depending on your procedures and patient populations, we warmly encourage you to use Hand-Held Nitrous to increase patient satisfaction while they're in your care, regardless if you are practicing in a hospital, clinic, or small office. Make sure you're using pure nitrous oxide gas supplied only by Strata Medical Innovations, with the clear understanding that it is to be used only as indicated and not for recreational use. The inhaler and the nitrous oxide cylinders are both CE marked. Failure to use CE marked gas and to use only as indicated will remove any warranty you may have. Never use the inhaler or allow others to use the inhaler without either the nose cannula or the mask accessory, and never use or allow to be used upside down or horizontally. Think of compressed nitrous oxide gas as a very cold liquid. Although the inhaler with its accessories have been designed to reduce ice burn, cold liquid may drip if not used right side up, or ice may be ejected if used without the proper accessories. Exposure limits are safe and extremely low, even under worst-case tests. However, if you are in a small exam room and perform many procedures a day, avoid inhaling the gas exhaled from patients by confirming air passes past the patient's face first and out the room, away from you and your staff. A simple test using the feather may be helpful. Perform simple tasks, including positioning the table so that the patient's head is nearest the outgoing air vent or door, or turning on the air to the room. If you're not sure whether air leaves the room, consider leaving the door partially open. The inhaler is reusable and is considered a one-time purchase. The refills are disposable and are discarded after each use. Each disposable refill consists of either a nose cannula or mask accessory with the gas cylinders. Inhalers are made up of a cup, head, compression switch or trigger, and a nozzle for either the nose cannula or mask. The nozzle is not interchangeable on your inhaler. You must purchase the inhaler applicable to the specific nose cannula or mask accessory. The gas flows each time the trigger is activated. The mask design requires a connector which attaches the nozzle of the inhaler to the mask. Never discard your connector. You will need it for the next patient. To assemble the mask inhaler, attach the connector on the nozzle to one end and the mask on the other. It only goes one way. For the nose cannula accessory, no connector is required. Simply attach the nose cannula firmly to the nozzle. Load the gas by placing the cylinder into the cup. Notice the 2 yellow labels instructing you how to match the threads. Match the labels and you automatically match the threads. Screw the cup onto the head until a light resistance is felt. Then quickly turn 2 additional quarter turns, activating the gas cylinder. You may hear a slight hiss. This is normal. If you continue to hear a hissing noise, tighten again another quarter turn. If the hissing noise continues, you have misthreaded. Set the device down, wait 15 minutes, and try again. If you're using the Hand-Held Nitrous to calm or reduce anxiety in the patient, make sure the patient is sitting or laying down, and insist that the patient remain so for at least 6 minutes. after all the gas has been administered. There are no exceptions to this rule. If you're using handheld nitrous to reduce pain during a procedure, exam, or injection, prep the patient accordingly. Again, the patient must be sitting down or lying down. The healthcare professional must be in the room and ready to begin. The patient will feel the greatest effect of the gas within 4 to 5 deep inhalations, regardless of which accessory is being used. The inhaler must be held upright during gas administration. If you are using the nose cannula, in most cases, it is safe for the patient to self-administer because it is easy to hold the inhaler upright, regardless of the patient's head position. When using the mask, if the patient, 1, is an adult, and 2, sitting up, the patient can self-administer the gas to themselves. However, if the patient is a child or the patient is laying down regardless of age, the healthcare administrator must hold the inhaler for the patient. If laying down, the patient must turn their head towards the inhaler. The mask rotates on its axis so that the inhaler can remain upright. Start the most painful portion of your procedure after about 3 to 5 deep inhalations after you begin administering the gas. The effects of the gas are directly proportional to how much gas the patient inhales. Instruct your patients not to stop the inhalation process after they begin unless they no longer wish to feel the effects of the gas. Instruct adults to place the mask over the nose and press the trigger, which starts the gas flow. Instruct them to inhale deep and slow and hold their breath each time. There may be a hissing noise and white mist. This is normal. When they hold their breath, instruct them to release the compression switch, stopping the gas flow. Repeat 5 times without stopping. Then continuously release the gas and breathe without holding their breath until the gas is completely gone. In situations where it is too difficult to explain to the patient how to self-administer the gas because of age or comprehension, simply administer the gas to them continuously and do not instruct them to hold their breath, but simply breathe deep and slow. If using the nose cannula, place the nasal cannula in the nose, around the ears, and under the chin. Press the trigger, which starts the gas flow. Instruct them to inhale deep and slow through their nose and hold their breath each time. When they hold their breath, instruct them to release the compression switch, stopping the gas flow. Repeat 5 times without stopping. Then continuously release the gas and breathe without holding their breath until the gas is depleted. Patient experience will vary from strong effects to very little. A small percent of the population may not feel any effect at all. In most cases, you will see pain and/or anxiety reduction. Your patient will feel more relaxed. They will be awake, even though they may close their eyes. They can still hear you and understand your instructions. Pain will not be completely eliminated, but it will be diminished. The effects of the gas will leave the patient within 5 to 6 minutes. Make sure the patient is not left alone until the patient returns to baseline. Parameters include the patient is not dizzy, can ambulate, can communicate clearly, has minimal nausea, is absent of any respiratory distress, and is alert and oriented as appropriate for age. If there's a problem associated with the patient and his or her exposure to nitrous oxide, give oxygen. Disposal of the used gas cylinder requires several important steps and is always to be performed by the healthcare professional. Remember to always release all gas before removing the cylinder from the inhaler. Remember, adults can receive up to 2 doses per procedure, so in some cases you will be replacing cylinders during the procedure. When all the gas is removed, while holding the inhaler upright, slowly twist off the head from the cup. If there is a hissing noise, stop until the hissing noise stops, then continue. Remember to think of the nitrous oxide as a very cold liquid. Do not assume that there is no nitrous oxide left in the cylinder. Without touching the cylinder or turning the cylinder upside down in your hand, drop it directly into the garbage, directly from the cup. You are then free to load another cylinder or store the inhaler for the next patient. Thank you for taking the time to watch our training video. Should you have any questions, we encourage all of you to visit handheldnitrous.com, speak with your distributor, or contact the company directly for more information.